National Advocacy Network has engaged over 50 youths on drug abuse and mental health related issues at Aberdeen, Crabtown, in Freetown. According to the executive director of the network, Egeline Tanisha Kamara, the engagement is part of their efforts to help empower young people in order to be self-sufficient. Our reporter Ibrahim Abubakar Kamara files in this report.
Drug menace has been recently evident among young people in the country and beyond. This ugly situation in the country has prompted several concerns among citizens as to what needs to be done in combating this menace. It is against this backdrop Safe Place International Advocacy Network has designed 3 solid programs which the executive director of the said network, Egeline Tanisha Kamara, says will help to address the high increase on drug abuse among young people in the country. She further notes that their visit to Crabtown is not only to sensitize these young people, but also to donate some food items as part of their Christmas and New Year bonanza.
We are here in Crabtown community as part of our empowerment project. So we are here to do a training and as well as donation. And the reason why we are doing a training and a donation, we want to train the youth as we have always been doing, so that they can be self-sufficient, so that they can come out from their drugs, the states they are. We want to rehabilitate them as well as remove them from their depressed states, because some of them have mental issue, some of them are battling with drugs addiction. And the type of training here we are doing today, one, we want to train them how they can empower themselves, because we have individual empowerment and also collective empowerment. So how they can empower themselves as individual and how they can empower themselves collectively. So that is the kind of training we are giving them today. And apart from the training, we are giving them additional donation from our organization. We are giving them some food stuff that they can be able to use to help their holidays.
Beneficiaries express their profound gratitude towards the gesture, while some share their experience.
I don't get experience how for left kush, how for the better thing for me future one tomorrow. All the man that avoid kush, the man that forget about kush, because kush now they destroy system. They act bad as that system, they act normal. So anytime we can normally smoke kush, we feel one carry, we don't make sense. So we avoid from that. We will be focused and concentrate, but it's not beneficial something. We won't future one tomorrow.
That's what I give you. I tell you, plenty, thank you. I showing love and opportunity to say that we for all tight with the woman there, so we're not for focus per man. So for all one. So even
the engagement ends with educative interaction between the network members and the participants, together with the distribution of some food items to these young people. Ibrahim Abubakar Kamara, AYV News, Freetown.
Head of Complementary and Alternative Medicines Pharmacy Board, Dr. Sir Emmanuel Bomo, has revealed that the obsolete laws addressing drug peddling and the attitude of citizens who boycott pharmacies and instead purchase drugs from peddlers as some of the major problems in the fight, also noting that it is a national concern. He also pointed out that the Pharmacy Board is still investigating the Coco Samba drink and have put out statements that they cannot guarantee its safety. He made this disclosure during the sub-appropriation process in Parliament. Samuel Tony Sawyer files in this report.
The Pharmacy Board Sierra Leone is the medicines regulatory agency set up by an act of parliament and charged with the responsibility of regulating pharmaceuticals, medical devices, cosmetics, the practice of pharmacy, and other matters related thereto. Over the years, the medical situation in Sierra Leone has been a challenge, with tons of drug peddlers in the streets, host of medicines, and low quality in pharmaceuticals and services rendered by pharmacists. The impact of these affects the life, health, and well-being of many. As Pharmacy Board faces one of the subcommittees on appropriation, Head of Complementary and Alternative Medicines, Pharmacy Board Dr. Sir Emmanuel Bomo, notes that the attitude of citizens and the archaic nature of pharmacy laws are a major problem in the fight.
The issue concerning the drug peddler issue, there are a number of contributing factors to it. First and foremost, the one is that the law currently, as it stands with the Pharmacy Board, it's a major issue currently, and I'm sure it has now become a national security issue. It's really a very serious situation But also, it also boils down to the attitude of Sierra Leoneans. Currently, 1,800 pharmaceutical outlets, in addition to over 1,000 primary healthcare units countrywide. People are still living. All of those areas are going to source medicines from drug peddlers.
He further explains on the categories of pharmacies while noting that the law does not mandate them to arrest drug peddlers.
As I said in the presentation, we have 3 levels of pharmaceutical outlets: patents, drugstore, and pharmacy. The pharmaceutical landscape has two. We have the regulated markets and unregulated markets. The regulated markets are the pharmaceutical outlets, the government hospitals, drugstores, primary health care. When you come to the regulated one, these are the drug peddlers, and these do not come under the pharmacy board and be strict to say so. This is the responsibility of the Sierra Leone. However, they are dealing in pharmaceuticals. Ours is part of this quality assurance for the general public. So it's also of interest to us in some cases.
He also commented on the status of the investigation on the Cocoa Samba drink.
This is not a regular pharmaceutical. For a regular pharmaceutical, they come with a testimeter for it. This is not a regular pharmaceutical. It does not have a testimeter, nor a label claim. So we've been doing our preliminary investigations. We've completed one phase of it, but we need to take it to the next level of confirmation. In the interim, we've put out in a general public to inform the general public that we cannot guarantee the safety and efficacy.
The committee further calls on Pharmacy Board to ensure they expedite investigation on the Cocoa Samba drink and also improve on their inspection and monitoring aspects. Samuel Tony Sawyer, AYV News, Freetown.